welcome to Exposé. I'm your regular host, Tony Akinyemi. We continue our conversation on cardiovascular diseases in general and hypertension in particular. We've done a number of episodes where we have looked at what hypertension is. We have looked at the different scenarios of your blood pressure numbers. We have looked at how to make sense of those scenarios. We have also looked at different complications that may arise from unaddressed hypertension. Now today what we'll be looking at is we want to look at how conventional medicine or official medicine, medical science, addresses cardiovascular diseases and hypertension in particular. I'll be sharing 10 different tools or call it protocols or remedies or interventions that medical science uses to address hypertension in particular and maybe cardiovascular diseases in general. Now, each of those I will discuss, and then subsequently I'll come up with my own suggested plan. Let me give a disclaimer up front here that whatever we share with you on this platform should never serve as a substitute for proper medical care. If you have a cardiovascular challenge or you are hypertensive, please work with your healthcare professional to address it. Don't take laws into your hands, as it were. You need experts, you need professionals to support you on your journey to recovery, on your journey to improved health, on your journey to wellness. But it's doable. It's a partnership that can be forged, and you can benefit immensely from that partnership, particularly if you find the right partner to go on with you on your journey to recovery. So let me share with you the 10 different modalities, 10 different interventions that official medicine uses in addressing hypertension in particular. The first one, a group of drugs that they use in addressing hypertension that are called diuretics. I will be explaining them in details later. I'm just going to catalog the 10 of them first and foremost. Diuretics. That's a group of drugs that they use in medicine to address hypertension. But that's not the only type of drug that is used. There's another group of drugs. That's the second type of intervention now. They are called beta blockers. B-E-T-A. Beta like alpha, beta, gamma. Okay, beta blockers. The third group of drugs that official medicine uses to address hypertension, those drugs are called calcium channel blockers or CCBs. Calcium channel blockers. And then the fourth group of drugs that are used in addressing hypertension is called ACE inhibitors. I'll be giving you details of each one of them shortly after I have finished cataloging them. ACE inhibitors, a group of drugs, that's group number 4. Now the fifth group of medications, pharmaceutical drugs that doctors use in addressing hypertension in particular and cardiovascular problems in general, they are called blood thinners. Blood thinners, to thin the blood so that it can improve circulation to prevent blood clots that can cause strokes or heart attacks and so on and so forth. Now, the sixth group of drugs used in medical science to address cardiovascular challenges in general and hypertension in particular, they are called statins. S-T-A-T-I-N-S. Those are cholesterol-lowering drugs. There are a number of drugs in that category that doctors normally prescribe to lower cholesterol for hopefully improved cardiovascular health. But I'll be sharing my perspective along the line. Number 6 group of drugs that they use in addressing cardiovascular challenges in general and hypertension in particular are called sedatives. These are sleeping pills, drugs to sedate you to make you sleep off. Because sometimes sleeplessness or insomnia could be the reason for hypertension. So by the time they put you to sleep and you're able to relax, then hopefully your BP can also come down. And then we have the 8th group of drugs that they use to address these issues, they are called angiotensin 2 receptor antagonists. Angiotensin 2 receptor antagonists. That's a group of drugs. Then we have the ninth group of drugs that they use. They are called direct renin inhibitors. These are another group of drugs, direct renin inhibitors. Now, all of these things will be displayed on the screen for you so you can see their spellings and note them correctly. And then the final one I'll be discussing, the 10th intervention in medical science, in the arsenal of medical science. These are invasive procedures, and I'll be explaining what that means. That means procedures that may require the doctor going inside your body to perform some operations, either by installing a pacemaker, for example, or performing open heart surgery, or doing bypass surgery. All of those are invasive procedures. These are the 10 types of, remedies or interventions that are used in the armament of medical science in addressing cardiovascular diseases in general and hypertension in particular. So let me take them one by one to explain them in detail. But before I do, again, I think this is a good place to pause, catch our breath, and take a break. When I'm back, I'll begin to share elaborately on all the 10 points one by one.
I believe you've been having a terrific time with me on Exposé with Tony Akinyemi. We have great resources that will bless your life available to you on healthy living and many other life subjects. We have various platforms where you can obtain materials for your blessing. You can obtain some of our work, our books, particularly on Amazon.com. How to Regain and Retain Your Health is a book title that I highly recommend. It's available in digital format, Kindle edition, as well as in printed version. We also have juices and smoothies for healing, health, and pleasure. You can also find these items at another website, familabooks.com, Famila books.com. And for those of you who are in Nigeria, you can reach us at the Shepherd Store, 18 Tokule Street, off Mobolaji Bank Way, behind Exposé Place, to get our material. We have over 600 recorded audio CDs, DVDs, VCDs, and MP3 on various subjects. All these things that I teach on Exposé are already available in their complete format. How to reverse hypertension naturally, how to reverse diabetes naturally, how to reverse arthritis naturally, and many other wonderful titles. I encourage you to visit this website, Amazon.com, familabooks.com, or TSF bookstore in Ikeja, Lagos, Nigeria, and you will be blessed reading those materials, sharing them with your friends and family. Thank you once again. God bless you.
Welcome back. This is Exposé, and I am your regular host, Tony Akinyemi. Now, I have cataloged 10 different modalities that official medicine or medical science uses to address cardiovascular problems and hypertension in particular. And so I want to take each of those 10 one by one and explain them a little further in layman's language that all of us can understand. The first group of drugs that they use are called diuretics. Now, diuretics are drugs that help your kidney to form urine very quickly and flushes out, they flush out excessive amount of water in the body. Okay, that is diuretic. There are medicines that are used to treat. They are used to treat heart failure, fluid retention from heart failure, or side effects of calcium channel blockers. And they work by stimulating the kidney to increase urine output. Those are diuretics. It is believed that if, like I mentioned in the previous episode, if a person has a lot of toxins retained in their body, definitely the toxins can be toxic to the body. And the body is very intelligent. The human body was designed by God to be very intelligent. That's why the Bible says, in Psalm 139 verse 14, I am fearfully and wonderfully made. Once the body senses there is a lot of poison being retained in the body will begin to retain water to dilute it so that it will not be too concentrated and become too toxic. So in the process of accumulating fluid in the body begins, the blood pressure begins to go up. So it is believed that if you can flush out this excess accumulated fluid, blood pressure can come down. That is one of the reasons for diuretics. Now, when I talk about mineral balancing later, when we're looking at our 8 strategies for reversing hypertension, I'll be talking more about sodium-potassium balance. But let's reserve it till then. Sometimes people eat a lot of salt, for example, refined salt, and so they have excess sodium, too much sodium in their body. Or maybe because their kidneys have been compromised, the kidneys are no longer effectively removing waste products from the body. So you have excess minerals like sodium retained in the body. And when there's too much sodium in the body will definitely retain a lot of fluid, water, to dilute the sodium, and then the person has excess fluid. So you take a diuretic to flush out this excess fluid. One of the downsides of diuretics is that sometimes it also flushes out very much needed minerals from the body. But they are beginning to design some pharmaceutical diuretic drugs that are now mineral sparing, potassium sparing in particular. They spare potassium, they don't flush out potassium from the system because you do need a balance of potassium and sodium among other minerals to maintain normal blood pressure. Okay, but just understand that diuretics are drugs that flush out excess fluid. They make you urinate and urinate and urinate. And that's why when some people are placed on diuretics, you find out that they begin to get dehydrated, and number 2, they begin to have dry throat and dry mouth all the time because the drugs, are flushing out excess fluid from the body. That is the downside of diuretics. Then there are also some food items actually that can also exert diuretic effect when you eat them. If I need to use a diuretic, rather than use a pharmaceutical diuretic, I am going to be eating foods like cucumber and watermelon. Those are diuretic foods as well. They can help to flush out excess fluid. They can help the kidney to form urine and increase urine output. And the good thing about those vegetables and fruits is that they are mineral sparing. They will not flush out the minerals in your system. It's only whatever needs to be flushed out that will be flushed out. So take note of those 2 among several others. At least you know that watermelon and cucumber are diuretic fruits and vegetables. Cucumber is a fruit vegetable, whereas watermelon is a full-blown vegetable. Okay? So that's the first group of drugs used to address hypertension. They are called diuretics. Now, the second group of drugs that are used to address hypertension by medical doctors, they are called beta blockers or beta adrenergic blocking agents. Beta blockers. They are used to treat a variety of conditions such as high blood pressure, glaucoma, migraines. Glaucoma is usually when there's too much pressure in the eyes. I call it hypertension of the eyes. One of these days, we may be dealing with glaucoma to understand what it is, how it happens, the different types, and what you can do to bring down the too much pressure that is in your eyes and normalize your eye pressure. It's a simple thing that can be done and achieved within 90 days without surgical intervention. Okay? So let's leave that till another time. The second group of drugs is what we're talking about, beta blockers. Now, they block the release of the hormones, adrenaline and noradrenaline, in certain parts of the body. Those hormones are the stress hormones that are produced by our adrenal glands sitting on top of our kidneys. And they help us in the fight or flight syndrome. When your life is faced with danger, your body is primed to either fight back or to flee. It's called the fight or flight syndrome. And there are certain hormones that help the body to achieve that fight or flight. Okay? These are called the stress hormones. Chief among them, adrenaline, noradrenaline, cortisol, and so on and so forth. Now, beta blockers are supposed to block the release of those hormones so that your body, when your body senses stress and your body wants to release stress hormones like adrenaline, the drug will block that release to tell the body, calm down, there is no danger, calm down, relax. Okay? Essentially, that is the job of beta blockers. But they don't come without their side effects. Okay? So I'm going to be talking about a few of the side effects of beta blockers and some of the less common side effects that may also happen when somebody is on beta blockers as a medication to address hypertension. Okay? For example, some of the side effects include dizziness, excessive tiredness, blurred vision, cold hands and feet, slow heartbeat, diarrhea, nausea, feeling like vomiting. Those are, some of the regular side effects that some people experience. Not everybody, but some people experience them when they are taking these beta blockers. But there are some less common side effects which include insomnia or sleep disturbances. Imagine somebody has hypertension. He's taking a beta blocker in order to address the hypertension, and then he cannot sleep. What's going to happen? The BP will go up again. Another less common side effect is loss of libido. It affects the sex drive of the individual. I mentioned that in the previous episode, that is it the hypertension that is affecting the libido, or is it the medication being used to address hypertension? And now we can see that one of the side effects of this group of medications called beta blockers actually cause loss of libido. And another less common side effect is depression. When some people are on some of these beta blocker drugs, they actually begin to experience depression. Okay, so that needs to be alright. Now, the third group of drugs being used to address hypertension by medical science, they are called calcium channel blockers, or CCB. They are oral medications, tablets, okay, that relax the muscles around blood vessels to allow better blood flow through those blood vessels. Now, let's assume this is a blood vessel. Now, a pipe where blood flows through, all right? And then there are muscles around it. If those muscles are tensed up, they are going to constrict the blood vessel and they will narrow it. But when you take a drug to relax those muscles, then it makes the blood vessel to also expand or to dilate, and that will make the pressure inside to come down. That's how CCBs, or calcium channel blockers, that's how they work. They relax the muscles around the blood vessels to allow dilation of the blood vessels, to allow what we call vasodilation, the blood vessel to expand so that the pressure inside can come down. Because calcium as a mineral, as well as magnesium, are two important minerals that control the constriction and the relaxation of muscles. So when somebody, for example, is deficient in calcium, the person will experience muscle tension. The muscles will be tense. Then when you have enough calcium, your muscles can relax. Then when you also have deficiency in magnesium, you can be having muscle twitching, twitching, involuntary twitching of muscles because of low level of magnesium. So minerals play very important roles in our musculoskeletal health, both in the muscles as well as the skeleton, for the majority of your bone is calcium. Alright? So these drugs block the absorption of calcium in such a way that it is allowed to continue to freely circulate so that it can relax the muscles around the blood vessels to allow circulation. They also affect the electrical system of the heart. That's calcium channel blockers. They affect the electrical system of the heart, and they are used to slow down or regulate fast heart rate. When somebody has palpitation and the heart is beating, calcium channel blockers can be used to slow down the beating of the heart. Okay? And then they have been used for over a quarter of a century right now. They have a very good track record, except that some of those, there are some side effects that also come with it, which some people are able to live with, others don't like it at all. I must underscore the fact that calcium channel blockers are prescription medications. It's not something you can buy off the counter by yourself. Okay, they are not OTC, they are not over-the-counter drugs. They are prescription meds. So you have to, your doctor has to assess you and consider it useful for you before prescribing it for you. Okay? So they also have their own side effects, adverse effects of taking calcium channel blockers. I'm going to run through some of the side effects of CCBs. Number one, some of them are relatively non-life-threatening, whereas some of them may be life-threatening. The relatively non-life-threatening side effects of calcium channel blockers include abdominal pain, constipation, drowsiness, fatigue, heart palpitations, flushing or hot flashes, nausea, headaches, sore throat, swelling or water retention in the extremities of the body. But then there are also possibly some serious or life-threatening side effects that calcium channel blockers may bring on. And this includes chest pain, heart attack, serious low blood pressure symptoms such as dizziness, lightheadedness, and fainting, severe water retention with difficulty breathing, which can be signs of heart failure. It can also bring on depression. It can make a person to become paranoid. It can bring on paranoia. Okay, to be paranoid is a kind of psychological or psychiatric disorder where you are so almost unrepentantly pessimistic, and you don't almost see anything good in anything. Whatever is happening, your perspective, the way you interpret the events around you is always negative. Okay, you see two people standing and they are talking and suddenly they burst into laughter. You just jump to the conclusion that it must be you they are discussing and they are laughing at you, even when what they are saying has nothing to do with you. You are just paranoid. Okay, that's called paranoia. The psychiatric disorder. And sometimes the medication being used to treat hypertension, calcium channel blockers, can bring on paranoia. Can you imagine? Then it can cause gynecomastia, which is enlarged breast. So you see a man with almost needing a bra to wear. Okay? Then it can cause temporary blindness sometimes. Then various allergic reactions such as swelling, inexplicable rash, itching, difficulty breathing, wheezing as if one is asthmatic, and all of those things are possible side effects. Now, if you're on any of those medications, just go through the pamphlet inside the medication and read, and you see the possible side effects or adverse effects that can develop by taking them. The fourth group of medications used to address hypertension are called ACE inhibitors or angiotensin converting enzyme inhibitors. Now, what they do is that, they inhibit the angiotensin converting enzyme, which is a component of the blood pressure regulating renin-angiotensin system in the body. They inhibit that enzyme. And when they inhibit that enzyme, that decreases tension in the blood vessels as well as the blood volume, and that results in the lowering of blood pressure. Now, they are specifically administered to regulate intercellular and extracellular fluid in the body and to reduce tension in the arteries. The arteries are those large blood vessels, to reduce tension in the arteries. This group of drugs can cause dilation of blood vessels, and that will result, of course, when the blood vessels dilate, when they expand, the pressure will come down. They are called vasodilators as well. They are usually used with other medications such as beta blockers and long-acting nitrates, as well as CCB, calcium channel blockers. Now, ACE inhibitors and channel blockers are usually sometimes combined together by medical doctors to get better effects, okay, in treating hypertension, particularly when hypertension is difficult to regulate. Now, usually when the person is just newly diagnosed with hypertension, a doctor may want to first of all start the person on just a diuretic, something like moduretic, for example, just to see whether that will solve it. If that doesn't help, then they begin to add more and add more and add more. Now, most doctors will combine what we call combination therapy in order to broaden the effect of the treatment. All right. The fifth group of remedies or interventions is what I call blood thinners. Blood thinners. The very strong blood thinners may include things like warfarin, but for the most part, many people are placed on low-dose aspirin. Low-dose aspirin. Aspirin is a blood thinner, maybe 50 milligrams, 75 milligrams, thereabouts. okay, of aspirin, 1 a day. Okay, that's a blood thinner to prevent blood clots and to improve circulation so that the person does not experience stroke or kidney damage or organ damage or heart attack or cardiac arrest or any of those things. They just place them perpetually on these blood thinners. That is another number 5. Now, sometimes these things can, blood thinners can actually lead to peptic ulcer. They can cause ulceration of the digestive tract, particularly when they are taken on an empty stomach. And then number 2, they can also sometimes overthin the blood and cause some internal bleeding. That's some of the downside of blood thinners. Now, I told you 10. We have covered 5. This is a good place to take a break. And when we are back today, I'll be continuing with the remaining 5 remedies in the armament of medical science in addressing hypertension. When we are done with medical science way of dealing with it, we will now come to natural approaches, DIY approaches that you can do at home for yourself.
My name is Olanike, a graduate of Rafa Institute of Healthy Living, a school run by Reverend Akinyemi, where we are taught how to take care of our health using basic healthy living principles. My coming into contact with the school has changed my life for the better. Prior to that time, I had been diagnosed of arthritis, I had pains all over me, I had difficulty in breathing. But since I decided to take the principles taught in the school seriously and I followed them, I discovered that my health has improved, I am free of pain, my breathing has stabilized to such an extent that I can run a gym. Can you beat that? So, I want to invite you. Come, join us at Rafa Institute of Healthy Living. Let's learn together how to reverse supposedly irreversible diseases using nutrition and lifestyle. All are basic principles. Your life will not remain the same again.
Welcome back. This is Exposé, and I'm your regular host, Tony Akinyemi. This has been brought to you by the Shepherd's Flock International Church. We have our parishes all over Nigeria. You can go to our website, tsfchurch.com, and you will find a church locator that will let you know the nearest church to your neighborhood. We also have parishes in the UK, United Kingdom, and very soon we are opening in other parts of the world. Now, the remaining 5 remedies available in the armament, or armamentarium, I should say, of medical science in addressing hypertension include statins. Number 6, statins. Statins are a group of drugs that help to lower cholesterol, cholesterol-lowering drugs. You have things like Lipitor, like Mevacor, and so on and so forth. Simvastatin, atorvastatin. They usually end with statin. Okay, they are called statins. These are drugs that lower cholesterol. But let me tell you this: in the year 2012. The United States Food and Drug Administration, FDA, announced that it will be requiring additional warning labels for statin drugs, so that those who will be taking those drugs will be warned in advance of the possible adverse effects. Among these warnings include that statins may increase your risk of, number 1, liver damage, number 2, memory loss and confusion, number 3, type 2 diabetes, and number 4, muscle weakness for certain types of statins. These are additional warning requirements that the FDA wants to mandate pharmaceutical companies to state in the pamphlet in those drugs before consumers consume them, so that you have informed consent. Before you swallow them, just understand that they can cause or they may cause some of these problems. Now, another thing that I must let you know today is that statin drugs, generally all of them, lower the amount of coenzyme Q10 in your body. They cause CoQ10 depletion. Now, coenzyme Q10 is that enzyme that your body utilizes in converting glucose to ATP for energy. You know, glucose, your body uses glucose for energy. But before glucose is used for energy, your body will first of all take it to the refinery, okay, and refine it into petrol. Before it is now used to run the generator. So the process of converting glucose to fuel or energy called ATP, adenosine triphosphate, requires coenzyme Q10 for that job. And the organ in your body that has the highest concentration of CoQ10 is the heart. And when you take statins, cholesterol-lowering drugs, they reduce the amount of CoQ10 in your body and thereby affecting the efficiency of the working of the heart. Okay, that's one of the downsides. Now, I read this from literature and I want to quote this for you. It says, statins have also been shown to increase your risk of diabetes via a number of different mechanisms. The most important one is that they increase insulin resistance, which can be extremely harmful to your health. Increased insulin resistance contributes to chronic inflammation in your body. And inflammation is the hallmark of most diseases, including heart disease, which ironically is the primary reason for taking a cholesterol-lowering drug in the first place. Now, it can also promote belly fat, high blood pressure, incidentally, can you imagine the antithesis there? Heart attack, chronic fatigue, thyroid disruption, and diseases like Parkinson's disease, Alzheimer's disease, and cancer, unquote, by Dr. Joseph Makola. Now, Dr. Joseph Makola also quoted by saying earlier in 2013, new research also found that taking higher doses of the statin, simvastatin, otherwise known as Zocor, atorvastatin, otherwise known as Lipitor, or rosuvastatin, otherwise known as Crestor, increases a person's risk of acute kidney injury by 34%, a condition that can be fatal. In all, according to Dr. Joseph Makola, statin drugs have been directly linked to over 300 side effects, and these include memory loss, cognitive loss, neuropathy, that's inflammation of the nerves in the extremities, leading to tinglings and numbness, anemia, low blood level, acidosis, increased acidity in the body, frequent fever, cataracts in the eyes, sexual dysfunction, an increase in cancer risk, pancreatic dysfunction, immune system suppression, muscle problems, and polyneuropathy, nerve damage in the hands and feet, and rhabdomyolysis, a serious degenerative muscle tissue condition, and hepatic dysfunction, that's liver dysfunction. Now, in some previous episodes, I have already discussed how to lower your cholesterol naturally without using statin. So, why take the risk of the possibility of developing some of these adverse things by using statins? You can just eat oats. Oats bran is very good in lowering cholesterol. Niacin, good old niacin, vitamin B3, very good. And then omega-3 oil, almonds, all these are very good in bringing down cholesterol. The seventh thing that medical science uses to address hypertension are sedatives and relaxants, such as Lexotan, for example, which works on brain chemicals to help to relax the person from anxiety, from tension, to be able to sleep, and they believe that if the person sleeps well, then BP will go down. The issue with Lexotan is that it could be addictive, so you shouldn't use it for a long time. You don't use it for more than 2 to 4 weeks. Otherwise, you get addicted to it and you will not be able to sleep except you take it. It can be used for a short period to normalize things, but not for long-term use. It requires a doctor's prescription before you take it. And one thing I have personally observed, both for myself and from others that I have worked with, is that when you use Lexotan to sleep, to help you sleep, even when you sleep for 8 hours and you wake up, you are not refreshed. You still feel weak and tired, even after 8 hours sleep. That's what my personal experience has been. In those days, when I used to use Lexotan, I don't use it anymore. Now I have natural approaches to help me improve my sleep. Okay? Now, number 8 is angiotensin 2 receptor antagonist, which is a group of pharmaceuticals that modulates the renin-angiotensin-aldosterone system in the body. Their main uses are in the treatment of hypertension, diabetic nephropathy, that's kidney damage due to diabetes, and then congestive heart failure. And then number 9, direct renin inhibitors, drugs that block the enzyme renin, and so on and so forth. And then number 10 are those invasive procedures that are used to address cardiovascular problems, like open heart surgery, like angioplasty, which is mechanically widening narrowed or obstructed blood vessels or arteries, and then bypass surgery when a blood vessel is blocked or almost completely blocked. They now take a blood vessel maybe from the person's leg and create a bypass to condemn the one that is blocked and create another channel that blood can flow through. Somebody told me the other day that surgical procedure in the United States costs nothing less than $45,000 to do a bypass surgery. Okay, that's a lot of money, but there are things you can eat and things you can avoid in your diet, and within the space of 90 days, you can actually unblock that blood vessel. Now, because of time, I will cut it off here. Next time, on the next episode, I will complete it, and then we will now move on to start looking at my 8-point plan, my 8-pronged strategy for lowering blood pressure or for preventing hypertension. It's been a good time with you today, and I thank you for joining us every Monday at 8 p.m. on our various social media platforms, on Instagram, on Facebook, and on YouTube. Don't forget to subscribe to our channel, press the notification button, like us on Facebook, and follow us on Instagram. And Exposé will bring you information for your health transformation. I love you, and thank you for your time today. Bye-bye.